explain to you how we're gonna wash your hair, how we're gonna take care of it, your certificate, etc. Your certificate, okay? Washing instructions, they are pretty much simple. So, you're gonna start the first hair wash after 2 days from now. So that means on 6th of April, you're gonna start the first hair wash, okay? So on April 6th, you're gonna start washing your hair, following this simple procedure, okay? So as for the body, you can start showering from today if you want to, but try not to take a hot shower, okay? So regarding the washing instructions, once again, you're gonna start on April 6th, which is after 2 days from now. First of all, you're gonna apply the lotion all over your hair, donor area and transparent area at the same time. While applying the lotion on the donor area, you can do that gentle massaging the donor area, which is the back and the beard. So you can gentle scrub and massage it, okay? As for the transparent area, you need to be very careful while you're applying it. So only gentle tap on the transparent area to spread the lotion on, okay? And try to put a really thin layer of lotion all over the transparent area because sometimes it's getting a bit hard to get rid of. So if we apply the lotion on both areas, the donor and transparent side, then you need to wait for an hour with the lotion on. Then you're gonna follow that up by applying the shampoo. But before applying the shampoo, you need to make a foam out of it, okay? So put a little bit of shampoo on your palm with a little bit of water and just rub it like this way to generate the foam that you need, okay? Same story, gentle tap on the transparent area, gentle massage on the donor area, okay, dear sir? So, after applying the shampoo foam on top of the lotion, wait for a couple more minutes with both of them on, then wash them off or rinse them off by using a glass or bowl or even a bottle of warm water. Do not use any kind of pressure shower or any kind of shower, okay? So just with a glass of warm water, pour it all over the transparent and donor area to wash the shampoo and the lotion off, okay? After that, there might be some lotion that's going to be sticking on the transparent area. This is why I told you to put a really thin layer of lotion, okay? You can manage to get rid of this by using the spray water bottle, okay? So just bring yourself a nice spray water bottle and just spray all over the transparent area so you can get rid of the remaining lotion. Another round of warm water just to wash it off completely. After finishing with all that, you need to dry your hair. How you can do that? By using the hair dryer. Arm length distance on cool air, or you can just let it air dry. That means drying by itself, okay? So, you need to repeat and follow this method once a day for 14 days starting from this date, okay? So during these 14 days, the scabs are going to be formed and generated all over the transparent area and it's supposed to fall due to this method. If these scabs didn't fall off completely during these 14 days, don't force them to. It's okay to stay there. On day 15 from the first wash, if the scabs are still there, then you're gonna apply the lotion all over your hair, same thing, but this time you're gonna leave it for 2 hours instead of 1, okay? So you keep the lotion on for 2 hours, then you're gonna apply the shampoo on top, okay? You're gonna apply the shampoo on top without making a foam or something. Apply it, then massage the transparent area, massage it, okay? Of course, do not scratch it. You can just like gently or roughly rub it or scrub it, but do not scratch it. So after massaging your transparent area really nice, then you're gonna wash it with a low pressure shower, okay? So you're gonna see what's remaining of the scabs are starting to come off with some hair attached to it, which is gonna be completely normal. After getting rid of the scabs completely, there is no need for the lotion anymore. Another 15 days of daily wash by using this shampoo till it's finished, then you can switch back to your normal one, sir. Okay, so let us sum it up. First 15 days, shampoo and lotion, okay? Wash with a glass of water, dry with the hair dryer. Second 15 days with the shampoo only, and you can use the towels to dry your hair, and also you can use the low pressure shower to wash your hair. I will also provide you with the post-op number. This number is going to follow your case for the next period of time. Whenever you have any question or concern, you can text or dial this number and he's going to respond right away, sir. Also, to that same particular number, send your pictures to this number after 15 days, after a month, 3 months, 6 months, then after a year, so we can keep on your progress, keep update on your progress, sir. Okay? Everything is written here, by the way. Yeah, it's okay. No worries. Okay. So, this is the number that's gonna be your assistant, sir. Okay. So this is it regarding the washing instructions. Is there any question, Akane?
No, no, it's
Okay,
okay.
perfect. Okay, so we have also some optional medication to use, okay, for regarding the next period of time to maintain your existing hair, okay, dear sir, which is our main concern, because the transplant hair is not supposed to fall anymore, but the existing hair, it may fall, okay, dear sir. So these medications are to support of the old hair and also for the new hair, of course. So one of the options that we're recommending is the PRP or the laser treatment, okay, I mean plasma treatment, okay. So this one basically is going to take a sample from your blood, separating the blood from plasma, and taking the plasma, mix it with some medication, then inject it direct to this whole area, okay. This medication is going to help the grafts cells, so it also is going to strengthen them at the same time, okay, and it's going to refresh the blood cycle all over the injected area, but it should be done every 3 to 4 months, okay, to see the final results of it. The mesotherapy shares the same concept as a PRP, which is injection, but this time medication are going to be injected in your head instead of your plasma sample. Okay, so this is one of the options that we're recommending. Laser treatment, which you already did, there's no need to do it anymore. There's also the growth factor hair serum, which is a natural hair serum to trigger hair growing and reduce the hair loss. Okay, this one you can find it at our clinic, sir. Yeah, so this is one of the medications that you're recommending. There's also the finasteride or Propecia, which is highly recommended medication to use. Okay, so this one you can find it at any pharmacy. Okay, it's really good to use, and also we recommend to use the Rogaine. Rogaine is a good option to use, but if we recommend to use Rogaine if you didn't get the growth factor from here. What else? Yeah, there is also the finasteride gel. Okay, the finasteride gel is alternative for the finasteride tablets. Okay, so it's topical, not something you can take. Okay, as for the Expedia or Salplamero, they are multivitamins, and you can have them as an extra, sir. Okay, so this is pretty much it from our end.
When should I do these or
PRP or mesotherapy? Only the PRP or mesotherapy, you can do it after 2 months from now. As for the rest, you can start after 18 days.
Okay.
If you want, of course. But of course, we recommend to use it. All of them are medication. All of them are hair supplements, sir. But like I told you, these two, after 2 months.
So how can I do this? I mean...
Where do you live, sir?
I live in Germany.
You live in Germany. You can do it. As for these two, you can do it. Any dermatologist or any aesthetic clinic can do it for you, sir.
Okay.
Yeah, it's available all over the place.
Okay.
Yeah. As for the rest, yeah, you can find it also.
And if I don't follow these things, it would be a problem or maybe...
No, sir. It's not going to be a problem for the new hair, but it might be a problem for the old hair.
Okay.
Yeah. Because the old hair, like I told you, it may fall. Yeah. So this is why we're recommending to use the medication in the first place.
You mentioned a lot of medicines. So
yes.
Is there any that...
Particular ones?
Yes, 1 or 2 maybe.
This one and this one.
If I take the gel because I don't...
Yeah. I understand. Yeah. This one and this one.
This one is...
The growth factor and this one, yeah.
Growth factor is some kind of a gel or something?
It's a serum, sir.
Serum,
yeah.
Okay. So I can buy this one and then just apply it
yeah.
to my hair?
Yeah. Okay, sir?
Okay,
yeah.
Thank you.
Welcome, sir. Let me just wipe it up for you and we are done here. Okay, I'm just gonna put it on your file. This is mine. This is yours. Put it here. This is your hat. By the way, sir, you can wear the hat after 2 days from now because you did the sides. So this is why, by the way, this is why we didn't apply the headband for you.
Okay.
Because of the sides, because of the temples.
Yeah.
Okay. So you may just suffer from a little bit of swelling, more swelling than usual. But this is, like I said, due to not applying the headband for you, sir.
Okay.
So try to take your anti-swelling pills, okay, regularly, and also try to drink water as much as you can.
Okay.
Whenever you're outside, in case you're outside, just go with an umbrella, sir.
Okay.
Yeah. Okay.
Thank
So we're finished, sir.
you. Thank you.
Welcome, sir.